disease is a rare autoimmune disorder. It leads to inflammation in various parts of the body. The condition causes recurrent ulcerations, frequently affecting the mouth, but also the genital area. These ulcers can go on to cause scarring in these areas. However, it's a much broader condition, and it can result in joint pains, abdominal discomfort, headaches, and neurological issues, including inflammation within the spinal cord. In some cases, individuals could experience inflammation in the brain. This could lead to thrombophlebitis, inflammation of the blood vessels, and eye inflammation, including conditions like uveitis, keratitis, optic neuritis, or occlusion of the retinal vein. Behcets can affect anyone, but it's most commonly diagnosed in young adults, typically diagnosed between the ages of 20 and 40. It affects men and women equally. Its prevalence varies significantly depending on geographical location. Behcet's disease has a historical link. It's linked by an old trading route known as the Silk Road, which is why it's sometimes called Silk Road disease. This route goes through areas of the Middle East, Far Eastern Europe, and into China. It encompasses, in particular, countries like Turkey and Iran, where the disease affects many more people, as many as 1 in 1,000 to 1 in 1,200 people. The incidence in Japan is around 1 in 10,000. In Western countries, such as the United States and many European nations, this is a much rarer condition, affecting only 1 in 50,000 to as low as 1 in 370,000. We haven't fully understand the origin of Behcets, but we've definitely identified that it combines genetic and environmental factors in its development. There are specific gene markers, particularly a subtype of HLA gene that's known to increase the risk of the disease. However, this HLA type may be incredibly common in some parts of the world, so its use is limited. It's believed that an overactive immune system is responsible for the inflammation seen in Behcets. This leads to the immune system attacking the body's own tissues. The release of cytokines or inflammatory molecules can contribute to further inflammation, which then results in the wide range of symptoms we see with the disease, from the mouth ulcers and genital ulcers through to the joint pains and neurological disorders. Diagnosing Behcets can be particularly challenging. This is in part because the symptoms overlap with many other conditions, but also because there is a lack of a highly sensitive and specific test that can rule out other conditions and effectively confirm Behcets. A specialist, therefore, typically is involved in diagnosing the disease based upon the medical history, i.e. the story of your symptoms, and a physical examination. In particular, recurrent oral ulcerations, at least 2 episodes, and genital ulcerations within a 12-month period are part of the diagnostic criteria. Blood tests may detect rise in inflammatory markers, such as the C-reactive protein or CRP and erythrocyte sedimentation rate, but these are not specific to Behcets. Imaging like CT and MRI imaging can be used to detect vascular involvement. One test that can be useful is pathogy. This is to do with the body's reaction to pinprick testing, which is usually overreactive in Behcets. However, you can still have Behcets and have a negative pathogy test. There's presently no cure for Behcets. Treatment is focused on maintaining the condition into remission and managing flare-ups when they occur. Initial treatments could include non-steroidal anti-inflammatory drugs for the pain. Mouth and genital ulcers may respond well to colchicine. In more severe cases, steroids like prednisolone may be used. When first-line treatments are ineffective, disease-modifying anti-rheumatic drugs such as azathioprine and methotrexate are used. In some situations, apremilast can be prescribed, or targeted biological therapies like anti-TNF drugs. Patients with Behcets require the expertise of multiple specialists, depending on the organs that may be affected. This may include a rheumatologist at the centre of the team, with involvement of dermatologists, ophthalmologists, and potentially other specialists like neurologists. In some cases, the support of therapists like physical and occupational therapy teams may also be helpful. Lifestyle changes can also help in managing the disease. Alongside maintaining a balanced diet, regular exercise and stress management techniques can certainly improve overall health and coping with the condition and its symptoms. Patients should certainly avoid smoking and limit alcohol consumption. Behcets may be a rare condition that requires early diagnosis and appropriate management. Behcets remains a complex and rare condition. If this condition can be picked up early, complications and long-term issues associated with Behcets can be prevented. It's far more specific in certain regions and those of particular ancestries, which may help to highlight the potential risk for Behcets. Thankfully, with the right treatment and ongoing care and monitoring, people who suffer from Behcets disease do lead a full and active life. But for those who are experiencing recurrent oral or genital ulcerations, seeking medical advice is important for timely intervention.